Hey everyone, this is Jim Huffman with the Integrated Benefits Institute. We'll give it just 1 minute as we open up the doors and let everybody in.
You're coming in. As you come in, put in the chat where you're located.
Okay, it looks like it started to got a good group coming in. So let's get started. And welcome everyone. As the president of the Integrated Benefits Institute, I'm delighted to host today's webinar addressing a critical workplace challenge, loneliness as a social determinant of mental health. This topic has emerged as a key focus in our ongoing research into workplace well-being and productivity. I'm particularly pleased to introduce our speakers today. Carole Bonner, the lead researcher on this project, who will share groundbreaking findings from our latest study, and Christin Kuretich, Vice President of Supplemental Products at Voya, whose industry expertise will help us bridge research insights with practical solutions. Carole, I'll turn it over to you to begin walking us through the research.
All right. Thank you, Jim. And thank you all for joining us. I'm Carole Bonner. As Jim stated, I am the lead researcher on this project for IBI. I'm excited to be here with Chris and Jim to address this critical issue, loneliness, but not just loneliness, loneliness as a social determinant of mental health. This topic affects not only individuals, but also the resilience and productivity of our workplaces. Today, we'll explore how and why this happens and what we can do about it. We're going to first talk about research on loneliness and mental health, and then relay the implications. And then I'll turn it over to Jim and Kristen for discussion. Again, if you have any questions, send them in the Q&A, and we will address it throughout or at the end. So today we're tackling a critical issue that affects both our workforce and society at large. Let me close this. Loneliness, but this isn't just about feeling alone. Let me share some striking numbers with you that sort of put this in perspective. Imagine walking into a conference, a meeting, and looking around. Every other person you see, that's half, report experience significant loneliness. This isn't just a personal challenge, it's a public health crisis that's hiding in plain sight. This is according to our epidemic of loneliness and isolation as put out by the US Surgeon General in 2023. So what exactly do we mean by loneliness? It's more than just feeling or being alone. We define it as distress that comes from unfulfilled social needs, the gap between the meaningful connections we need and the ones we actually have. And the impact is staggering. We're seeing reduced job performance in the workplace. People are finding less satisfaction in their work. And perhaps most concerning for organizations, we're seeing increased turnover in tension. But here's the part that should really get our attention. Loneliness is linked to a 26% increased risk of premature death. That's comparable to what we associate with obesity and smoking. It's not just affecting the workplace, it's affecting our lives. So here's a silver lining, because that's a little bit depressing if you don't see the silver lining. We have an unprecedented opportunity. Employers and benefits professionals are uniquely positioned to make a real difference. By understanding these connections between loneliness, anxiety, and depression, we can develop targeted interventions that work. So at IBI, we launched a comprehensive series focused on mental health in the workplace to address one of the most pressing challenges affecting both employees and employers. Each part of the series addresses a different area. The economic impact of anxiety and depression estimates cost related to healthcare, absenteeism, disability across industries. Social determinants of mental health, which is where we are focusing today, is more of a public health perspective, and then a geographic perspective, which looks at states with high rates of mental health issues and states with high claims across the states. Our study leverages data from the Census Bureau's Household Pulse Survey, which is focused on employed adults aged 16 to 64. And we look at January 2023 through April 2024. We use validated screening tools. The Household Pulse Survey uses these tools within the survey. The Generalized Anxiety Disorder 2-item scale for anxiety, and the Patient Health Questionnaire 2-item scale for depression, and then self-reported experiences of loneliness. So when we refer to anxiety or depression, we refer to what is considered levels that warrant clinical evaluation and treatment as assessed by these scales. And when we refer to loneliness, it is the people who indicate that they often or always feel lonely. This is nationally representative, so it allows us to analyze the scope and the impact of loneliness in the workplace and highlight areas where strategic intervention could reduce its effects.
Carole, thank you for going through the methodology. I think the combination of validated screening tools with such comprehensive workforce data provides a real strong foundation for these findings. Could you walk us through what you discovered about the prevalence of anxiety and depression in the workforce?
Yes, our findings reveal critical insights into how loneliness correlates with mental health. Approximately 1 in 5 experience clinically relevant depression, while 1 in 4 experiences clinically significant anxiety. However, these numbers increase among specific groups. Young adults is way up there. They show the highest prevalence with nearly 40% reporting anxiety and 1/3 experiencing depression. Women have a higher prevalence of both anxiety and depression. Lower income individuals, those with less education, also report higher levels. Older adults and Asians, however, report lower rates of anxiety and depression, suggesting that certain demographics may act as protective elements. So these findings are essential for interventions to consider these variables. There's no one size fits all. And as I mentioned before, I'm just going to touch on some of the economic impacts of poor mental health. Sick days. Employees experiencing anxiety and depression take an average of 12.1 sick days annually, compared to 7.5 days for those without mental health concerns. This 4.6 day difference may seem small, but when you multiply it across an organization, it becomes a significant loss in productivity. For those whose mental health conditions result in short-term disability claims, the average time away from work is 80 calendar days, which is 57 working days. So this extended absence can disrupt teams, lead to delays, require temporary staffing solutions, each of which adds to operational costs. And those costs are detailed in that more extensive report. The effects of absenteeism also ripple through the workplace, leading to increased workload for remaining team members, potential burnout, reduction in overall morale. The estimated cost in lost productivity and healthcare expenses makes it a compelling case for preventative measures that can support mental health, well-being, and ultimately improve a company's bottom line.
Carole, the economic impact of those mental health challenges are striking, particularly when we look at the productivity implications.
Mhm.
Christin, let me turn to you for a moment. Just as someone working in product development within the benefit space, how have workplace loneliness and mental health shaped your thinking about the future of employee benefits?
It's significantly shaped it. It's been really beneficial to see research from entities like IBI and others who are focused on this issue. I think prior to several years ago, and I'll kind of point to the COVID-19 pandemic for shedding a huge spotlight on it. I don't know that this was as commonly talked about. So I think it was starting to get some groundswell and maybe a little bit more awareness, but the pandemic really, for better or worse, showed us that this was an issue and that it was not going away. I got introduced to the research on loneliness, actually, right, during the pandemic. And you mentioned Vivek Murthy, our Surgeon General, his paper that just came out last year. His book actually was from early 2020, which means he was writing it long before the pandemic. So
Right.
the irony of, him recognizing this problem and the impact, and then having this massive pandemic where we were all relegated to our homes, some of us alone in our homes and not able to leave, and not, your social circles cut down significantly, or in some cases altogether. So it really became something that I paid more attention to because I wanted to be better educated about it. And I wanted to think about ways that, other than trying to run around and give everybody I saw a hug, which really doesn't help the problem. It's probably not realistic, but that's how it made me feel. Like, oh my goodness, this is not something that we should sit quietly on. We need to figure out some practical ways to remedy this, because look at the potential downside. Look at what we're risking, not only from the work perspective, but really the health perspective. We're potentially risking significant health issues or worse, and it's having a massive impact on individuals. So for me, I think one of the threads that I see weave through research like what you all do, and other things that I've read, is this idea of providing language and psychological safety for people to be able to actually voice some of these feelings and put a name to it. Because I think it only perpetuates the loneliness when you have no idea how to talk about it, or even that it's a thing. But then hearing something like this, or hearing others share, might actually spark something for you to say, I'm feeling that too, actually. And now suddenly I'm not as alone because I hear somebody else has gone through these same types of things. So that's even just as a baseline. One of the things we try to do, not only here at Voya, within my own team and my colleagues, but how can we bring this into our work? So from the supplemental health perspective, or supplemental products perspective, which is what I lead here at Voya, we are very laser focused on some easy and maybe some more difficult ways to turn on some of these benefits. One of to me, the easiest ways is to look at things we've excluded in the past, like mental health related hospitalizations or mental health related disabilities, or we had, like, as an industry, we had caps on that. Or we might pay for mental health related, let's say, hospital stays, But if you were self-harming or attempting suicide, we weren't going to pay on that. Well, those two things just completely conflict. So it's just a miss. It's been lingering in contracts for decades. And so it's an opportunity to say, that's antiquated. That's not how we want to look at it anymore. Let's get rid of it. But we're still, I think, as an industry, trying to overcome this idea that mental health is not an illness, that we all could just try harder, cheer up, you'll get through it. And those, antiquated, tropes are still being shared. So as a carrier, trying to put better, kind of weight behind recognizing how significant this is, while removing barriers like exclusions and then adding specific benefits from a financial and a resource perspective, and being bold to talk about that. I mean, I don't stop talking about this issue, and it might be annoying, but I kind of don't care because I think that it's that important. And when someone comes to me and says, someone was talking about mental health the other day, and I wanted to tell you about it, then I know that at least the work we're doing is working because people are associating it with me, my team, and the work we're putting together. So we're very, very focused on this, and the research does nothing but continue to confirm and support and give us more and more reason and motivation to do what we're doing. So I know that was a long answer, but that's really what it does for me.
No, it's fantastic. And congratulations to you and the team in the organization for looking for those opportunities, because I think you're right. Many of those provisions have just been embedded in contracts and have been there. And we know they're not now, we know they're not right and they need to be addressed. So I think that's very forward looking and appropriate that your organization has done that. Hey, Carole, this brings us back to your findings about social factors. Why don't you elaborate a little bit more on how loneliness specifically correlates with those mental health outcomes?
Yes, our analysis, I used more advanced analysis to control for other factors. And we looked at work arrangements, which is a concern for mental health and loneliness. Fully in-person workers reported the highest level of anxiety and depression, while remote workers reported lower odds of these conditions. Flexible arrangements, such as working from home 3 to 4 days, showed a 27% reduction in the risk of anxiety and depression. However, these effects become statistically non-significant when you control for other factors. So that indicates that work location alone doesn't drive mental health. And I'll repeat that because it's important, because there's been a lot of talk in remote work and it fueling mental health issues, but this indicates that work location alone doesn't drive mental health outcomes. Instead, it's likely that flexibility itself, paired with supportive policies, helps to alleviate stress. Also, social factors. Social connection emerges as one of the most powerful factors in mental health. Employees who feel alone, feel lonely most or all the time, have a 6.4 times higher odds of experiencing anxiety and depression. And that's the largest finding from the whole series. 6.4 times more likely to experience anxiety and depression if you're frequently lonely. If you look at strong social support, whether from colleagues, friends, family, it reduces the likelihood of loneliness, of anxiety and depression, by as much as 90%. So this demonstrates that initiatives encouraging workplace relationships and community engagement could be critical for improving mental health. Also, we have parents. Parents, if this is worth mentioning, worth pointing out, parents of children with mental health needs face double the odds of experiencing anxiety and depression. So that highlights the compounded stress of caregiving. And we didn't have other variables for caregiving in this data set, but I would imagine that any caregiving that is high demand, like caring for an elder, someone with dementia, or those things carry higher risks of anxiety and depression. I know, Kristen, that you had actually we connected over this when we first met. Do you have insights on that caregiving piece?
I do have a lot of insights on it. I think we're going to talk about it a little bit on a later slide too, but certainly that is often a hidden problem we've found from research I did in a prior role and some other studies that are out there. Oftentimes employers aren't even aware of the caregivers within their organization. And as a caregiver, so for me, I was a caregiver for both my father with dementia and my husband through two bouts of cancer, essentially
Wow.
two battles, whatever you want to say. He's doing well now, thankfully, but certainly those were things that you have no choice but to kind of bring it to work with you. But it's not something that you talk about openly. And so here you are, you're really trying to put that on a shelf and compartmentalize for a minute and focus on your work. But for most caregiving situations, that is next to impossible. So it's very easy to, in those situations, kind of retreat and feel like, I'm probably not safe to share this. I don't want people to think I'm not working as hard. And also, I don't know, maybe I'm not comfortable sharing what's going on in my, my life with my loved one. Everybody has a different, kind of level of comfort there. So that can exacerbate the lonely feelings, which then, of course, as you're pointing out, lead to more anxiety, more depression, which is already very interwoven into a caregiving journey. Even if it's a pretty positive one, it's still
Mhm,
draining. It's still
mhm.
it's still such a difficult thing to journey through, and we kind of all face that at some point. But I know we're going to talk more about parents of special needs children and some of that later. I actually had an interesting thought on this slide, and maybe you have some more depth, or maybe not. I just love your opinion, but in that work arrangements, in that data, fully in person having the highest odds of anxiety and depression, that kind of flies in the face of what we would all imagine it to be. Like, oh, well, if you're in the office every day, how can you be lonely? And yet here we're seeing the opposite. So I'm curious what you two, either of you, think about that, or if you have any ideas of why that might be.
Something that I have run across in some other research is people who are fully in person. Some of them have to work fully in person. They're customer facing. They're dealing with customer demands. Um, so that would explain higher odds of anxiety, depression. Many of those are the lower income, lower college degree, where you see it turn up in other places, and this is why we control for factors to determine if it is just fully in person that's driving it, or if it's something else. So yeah, fully in person and odds of anxiety and depression is prominent. Um, but again, you've got higher stress levels, you've got commutes, you've got facing the workplace culture, you've got personalities, you've got things that you have to deal with that you might not otherwise have to deal with. So
That
we
makes
do
sense.
need to address these things. Yes.
Hey, Carol, a couple of questions that have come in
Hmm.
from our audience. Let me just surface these now for you. First one, how long has Household Pulse Survey been collecting loneliness data?
Yes, they started in January of 2024. So this is 4 months of data, and all that is detailed in the report. The loneliness and other social factors, social isolation, social activity, all of that is captured from January 2024 on.
Okay, second question. You mentioned the GAD-7 and the PHQ-9 as validated instruments for measuring, screening for anxiety and depression, respectively. What counterpart instruments are there for measuring loneliness? How reliable are they, and how widely are they used?
And there are instruments for workplace loneliness. I cannot recite those validation statistics off the top of my head, but they're just longer. One of the things that they try, and it's the GAD and the PHQ are the 2-item surveys, not the 7 and the 9. In surveys such as this, where they're large surveys, they try to cut down those questions as much as possible and use validated measures.
Right, and then our last question, how is frequent loneliness defined?
This is the respondents are asked, do you feel lonely? None of the time, some of the time, often, or all of the time. And so those who indicated the often or all of the time are the ones that we are looking at. Yes.
Okay, thank you.
Uh-huh.
I think we talked about the, and Kristen made a great point, because I was surprised, Kristen, as well, on the fully in person having the highest odds. I mean, that caught my eye when I was reading through the report as well. But Carole, I think you have some more specific breakdowns of prevalence across different segments, correct?
Yes. I have prevalence of loneliness across these segments because we see that loneliness is driving a lot of this anxiety and depression. So we want to know who's feeling lonely. So across the board, it's approximately 12.9% of the workforce that's feeling lonely. And again, these younger adults have the highest prevalence. So ages 18 to 24, they have a rate of 24.2, and ages 25 to 34 have a rate of 16.6. So the transition from education to workforce and the challenges of establishing a social network, social capital in a professional setting contributes to this high rate, but young adults in general, emerging adults and young adults are in a precarious phase of their lives. So lots of transitions. But I think it is definitely worth investing supportive measures because they are foundational to our future, right? So also income level is a factor. People with lower income level feel more alone. People with higher income feel less alone. And marital status. This is a big driver among non-married individuals. Loneliness is reported at 21.3%. And education, which is closely aligned with income. Individuals with some college education report loneliness at 16.9%. And then we've got the work arrangements, where we have people who are fully in person have a rate of 12.6%. Notice that 3 to 4 days per week report the lowest rate at 7.9. So we did the same kind of analysis for this as we did for the anxiety and depression, controlling for other variables. And again, the work arrangements appears to contribute. until you control for other factors. Factors associated with frequent loneliness are, well, demographics is Asian, who feel less. They're less likely to feel lonely. Ages 35 to 54 and higher, these are the lower rates. People who are single are more likely, 2.5 times more likely. People who are never married, 2.3 times more likely. But these social factors, if they have social support, and again, that could be at, at work, at home, they're 90% less likely to feel lonely. Church attendance, and this is a quirky sort of category because they also have clubs and organizations, which is not significant, but church attendance was significant. So those with frequent 12 or more times a year are 50% less likely to feel lonely.
And what's fascinating is how the data shows flexible work arrangements aren't the complete solution for addressing loneliness. The social connection findings are particularly noteworthy, especially the 90% reduction in loneliness for those with strong social connections. Carole, this seems like a good moment to recap the key vulnerable populations you've identified in the research. Could you walk us through that?
Yes, let's recap. So, young adults report the highest rate of anxiety, depression, and loneliness across the board. Nearly 40% struggle with anxiety, and over a third experience depression. The transition from education to a structured workplace environment, along with pressures of early career development, can amplify these issues. Non-married individuals experience loneliness at rates nearly twice as high as married counterparts. And so that emphasizes the support for these employees could be implementation of social engagement programs and offering opportunities for collaborative team-based projects to enhance the connection. Further, inclusive workplace policies, such as recognizing and valuing diverse relationship statuses and family types, can help all employees feel equally supported. And then we've got, again, we have the lower income employees who financial strain increases susceptibility to stress, and mental health interventions alone may be insufficient when addressing underlying financial concerns. But back to this, parents of children with mental health needs, employees who are also caregivers for children who have high demands experience twice the odds of mental health issues themselves. This group benefits significantly from flexible work policies that accommodates family needs, as well as resources specific to family mental health. Employer-sponsored programs such as family counseling, peer support groups for parents, external resource connections can offer caregivers the support they need to manage both their work and family responsibilities.
Yeah, the findings about caregiving really resonate. I mean, I think we're seeing it more and more. Christin, given these compounded pressures, how do you see the benefits industry evolving to better support working parents' holistic well-being?
It's such a great question, because the point about the work arrangements not really telling the whole story. And I know we had a question in the chat. I'll kind of connect those two things. And of course, part of this is really speculation, but I think it has definitely proven out in some of the data that we've seen. I think when people's mental health is supported, regardless of the reason, that can then impact the loneliness piece. So I think those two things are connected. But that also means just because you're around people doesn't mean there's an absence of loneliness. So I think there's a big opportunity here to model from top down and across. The psychological safety piece and the, compassion and kindness throughout your organization to let, no matter who is experiencing this, but let's talk about working caregivers and parents, let them know that this is a place that you're going to be able to do what you need to do for your kiddo, that we understand that you're going to prioritize their health and how they're getting through each day. And I have a couple very close friends who fit this description for completely different reasons with their kids. And I know that, their days can be completely unpredictable. They might be called in the middle of the day to pick up their kid from school, or maybe their kid just isn't able to go to school at all that day due to a mental health challenge or something else. So having that flexibility is important, but with that has to also be the sentiment that missing work doesn't mean that we don't believe you're dedicated to this job, that you have to make sure that you're not just allowing that flexibility, but that you're also coming alongside to say, and we support what you're going through and let us help you work most effectively. These programs that you mentioned, Carole, so peer support groups, family counseling, these are starting to become table stakes for benefits when people are taking jobs. It's no longer like a nice to have, it's an absolutely must have when you're taking a job. And especially for someone who, is a working parent of a special needs child, they're thinking, am I going to actually be able to do this job and live the life that I need to live for my child? Or do I need to go look somewhere else? And what they're going to do is look at the benefits package and what's available to them. So everything from leave policies to employee resource groups that are focused on caregivers, to some of these newer non-insurance but solution-focused benefits. So for me, thinking about caregiving, there are some really exciting new companies out there that support a very wide variety and also very niche specific caregiving situations. So there's a few companies I know that are very focused on family planning and early childhood. So they help with everything from postpartum to infant care, stress and anxiety, connecting them with others, kind of going through similar things. So it's very focused on children, even healthy children. It doesn't have to be someone with special needs, but hey, you're going on this parenting journey that can really help. You can feel isolated sometimes. So how can we help support you? And then maybe going the other direction, Carole, you mentioned elder care, and that's something I'm very familiar with. There are companies now whose entire, value prop is concierge caregiving services. So that, if you're sitting there at work, down the Google black hole trying to find Medicaid, rules in your state for your loved one, or trying to find what's the best facility or home health, company that you can get connected with. These companies can actually take that off your plate and do some of that legwork. And so from an employer's perspective, if I can't solve all your caregiving issues and all the unexpected things that are coming up for you. But if I can take some things off your plate and provide real tools that actually help you, then that frees up a little more space for you to think about putting on your own oxygen mask and thinking about what your own stress and anxiety levels are, and actually maybe having a minute to focus on your own mental health. So I think in the caregiving space specifically, there's a lot more than there was. These programs were not out there when I was going through this many years ago. I would have loved something like this. So it's really great to see that continue to evolve, and I'm sure that will grow. I think as we pay more attention to what different people's situations look like within our companies. I don't think we were paying attention before. We were putting everybody kind of in neat categories and keeping it moving. And we know that that's not the world today. And so I think expanding our minds and looking at this with more compassion and kindness is only going to help us.
Awesome. I like that you say expanding our minds. We have a question in the Q&A. If those who work from home are thriving better than those who have to report to office, yet one of the recommendations was to provide more opportunity for employee connection, how would this be possible? And this is a very good question. These are questions that people are asking, but the underlying foundation is we have to change the way we're thinking about these things.
Mm-hmm. Mm-hmm.
We can be at home and be connected.
Totally.
Yes. And so we can't do things the way that we did things when everybody was in office.
Yeah.
we have to change that. So we set up groups. Sometimes they're virtual groups. Peer support groups can be virtual. ERGs can be virtual.
Absolutely.
Yeah, and your teams need to come together. You encourage contact on a daily basis amongst team members. There are lots of ways to think about this differently. Either of you have any insight on
I have a
that?
couple thoughts. So I'll swing to like the other end of the spectrum. If we all remember early COVID days, how many of those like virtual happy hour events or virtual
Yes.
game times did you get? And if I got one more, I was going to lose it. I'm like, I
Yes.
want to sit on a computer and have a cocktail or play virtual games. It felt so forced because and I'm not going to knock because we were trying. We were desperate. We
Yes.
wanted human connection and that was the way we were allowed to. But to your point, Carole, we have to think about it differently. And the difference I see now, so I work in a completely remote first role at Voya. I've been here a little over a year. And I will tell you from day one, I have felt connection without meeting people in person, without going to an office, without that, spontaneous staircase meeting or seeing someone in the lunchroom or at the coffee, station or whatever. And that's because the connection or, emphasis on connection is authentic. We're not trying to create these false opportunities. We are freeing people up to actually foster real connection. And I'll go back to the kind of from leadership, across the org, that makes a difference. If you are, on a virtual call, but you're speaking like a robot, no one can really relate to you. I don't really get the feel of your personality. I'm probably not going to feel comfortable asking you for a meet and greet or shooting you a quick IM and seeing how your day is because I don't really know you. And without getting in that face-to-face interaction where we read body language and things like that, if we can't do that, the authenticity from a virtual perspective is even more important. So if I think about if I'm an HR, person and I'm thinking, how do I genuinely bring my people together? I think you got to free up time during the day for those organic connections, but you also have to look for those opportunities to make those connections real. And it's going to look different for every single organization.
Awesome, Christian.
Authenticity is the key there.
Mm-hmm.
All right, Carole, I think you've got the slide up there for the conclusion. Why don't you take us through the last slide here?
Yeah, so on that note, we have to shift from isolation to connection. And our findings highlight that quality social connections and support are the most protective factors against mental health issues. Employers who prioritize the connection can build workplaces that thrive, reducing turnover, reducing absenteeism, improving job satisfaction. And these are all of our goals. Support the vulnerable groups through tailored programs. Sometimes just knowing that something is tailored for you makes you feel cared for. Identify and support the most vulnerable employees and let them know what you're doing. Young adults, non-married individuals, caregivers, lower income individuals. Organizations can target their resources effectively, maximizing the positive impact on workforce well-being. Foster a resilient, productive workforce. Investing in mental health and social connection programs is an investment in resilience, productivity, organizational loyalty. Some people just love their group, love their team, love the culture. Even if there's some things they don't like, if you foster this kind of environment, you foster loyalty. Proactively support employees' well-being helps transform the workplace from a source of stress into a source of strength and community. So I'm going to, at this point, hand off to Jim. If we have any more questions, we can address them and let everyone know how they can access the reports.
Great. Thank you, Carole. We'll move into the Q&A in just a moment, but I want to mention how these findings really reflect the broader shifts that we're seeing in the benefits landscape. The traditional one-size-fits-all approach clearly isn't meeting the needs of a diverse workforce today. Kristin, what final thoughts would you share with on how benefits providers are adapting to these evolving needs? What are you seeing within your own organization and out there in the marketplace?
I think a couple things. I'll talk about what we're doing here in just a second, and it'll kind of tie to the question that was in the chat. But I do think I get really excited, and I saw it at the IBI forum about so many more of these companies, these quote unquote point solutions. I don't really love that moniker because it sort of makes it seem like it's an afterthought when it really isn't and shouldn't be. There's so many new companies popping up that are looking to address a wide variety or a niche, piece of these issues with a unique perspective and some different kind of resources than were available before. I think about total mental health companies providing comprehensive mental health solutions with everything from, full talk therapy to more like mental health coaching, meditation, all those types of things that can kind of, run the gamut of mental health support. And that's all provided, through a central company, where it used to be you had to kind of piecemeal it all together, and maybe you got some of it through your EAP. EAPs now are beyond table stakes, and we're basically seeing kind of the souped up, EAP version of things. But I get really excited about some of these companies that are focused specifically on areas that have kind of gone unnoticed before. Even if you think about something like an MSK provider, that seems like, how could that relate to mental health? Well, one of the biggest comorbidities with musculoskeletal conditions is a depression and anxiety, because it's so difficult to kind of continue to go through life in pain or frustration and not have any, light at the end of the tunnel. So those two things can live real closely together. And so providing something to deal with the MSK situation can also then in turn impact mental health. So I just think there's such a cool menu of companies out there now that go beyond just insurance. Since I'm at an insurance carrier, though, how I would answer for Voya, and even my other carrier companies in my same market, we're all focused now on where can we get rid of exclusions, how can we find different ways to pay on our traditional benefits that we've just missed before. So things like hospitalization, mental health therapy due to an accident, being embedded on accident insurance. Again, may not naturally seem like it goes together, but as soon as you say it, people are like, yeah, why didn't we have that before? So it's those kinds of things. In the chat was brought up that I did mention at the forum that Voya is working on an actual standalone mental health voluntary product, which we are beyond excited about. We are still in the kind of design creation phase, hoping to launch sometime next year. I will have more information, of course, as we get things firmed up, but we are very committed to this space. And the way we envision that product is both providing financial benefits. So similar to like an accident product will pay you for a broken arm, we want this product to pay you for a mental health situation. So it'll pay you money, and then we'll be attaching it to some comprehensive mental health resources. So I hope that something like that, which doesn't really exist today in the traditional supplemental benefits space, will start to provide even more help for the struggles that we're seeing, and then what your research just showed us.
Cool. Let me, if anyone has any questions, please type them into the Q&A, and we'll get to them here in this segment. Let me ask both Carole and Kristin their thoughts on the home setting. So a lot of our work and the research focused on the employee and the workforce and productivity, but we know that what's happening at home has a dramatic impact on an individual's ability to be productive in the workforce. So Kristin, from your perspective, what are effective ways that you've seen the messaging and the program availability and the importance of these support programs reach the home setting?
That's an interesting question. I love it. I think we have to, going back to your comment earlier, Carole, we have to think creatively about how we're delivering these, because we are not in just an office setting anymore. And if we think about the caregiver demographic that we mentioned, I may be working at home, trying to, kind of engage with these programs, but getting called away to take care of a loved one, or getting called away to take someone to a doctor's appointment, and how can I, think about this when I'm not just sitting at my desk receiving it through email like we used to always do. So I think a variety of platforms, maybe through text, through email, through IM, and then we talked a little bit about employee resource groups. I kind of think those are like a sleeper hit, they're everywhere, but a lot of times they're not really emphasized or promoted enough. So people may feel like they don't even know which one they'd even be interested in or what's available to them. And then a couple years in, they're going, I didn't even know we had that group. So I think that's an opportunity to maybe give these ERGs a chance to present and talk about, what their group focuses on, and maybe have people share their personal stories. And again, with that authenticity, delivering some of that communication in a way that weaves storytelling into what they're doing might engage somebody from their, home work, situation, because they're seeing real people. It's not just a little flyer that says, are you a caregiver? Join this group. Well, yeah, but why am I going to join that group? I have no tie to that. You haven't told me anything about it. Communicating and showing the need in a different way, I think, can really help. But those are my thoughts. Carole, what do you think?
Yes, I think that those things are important, but we need to start with training leadership to normalize these things, to make it a safe space to talk about these things, to encourage the flex time, and let their employees know that it's okay if you did this at 12 o'clock midnight.
Right,
Um,
right.
you know, I think that training and that normalization and giving employees the comfort in knowing that this is not a bad thing, it's actually a good thing, because I am problem solving and getting my things done anyway, and still meeting the needs of the people I'm caring for, or the team.
Yeah.
But I think that's a very big piece, the training and the culture.
It's a good point, because I think if you're training managers, because it can feel like an overwhelming problem. How can I make sure that every single employee is engaged in these programs? You can't. That's not
Right.
possible. Not in the same
Right.
way. So training managers to figure out what works for their team in terms of
Mm-hmm.
engagement and understanding of what's available, and even just an understanding what their specific situations are. Like, do you even know that you have, folks on your team that are experiencing loneliness or that feel disconnected? So one example I love to give is that I obviously talk a lot about mental health on my team, shocker. But there are some of my team members that if they see that I have been red all day, because that means I've been in nonstop meetings and they're waiting for me to go green and I have not gone green in 6 hours. I've had a couple of them reach out and say, have you gone for a walk today? Have you
Mm.
gone outside today? Have you gone, maybe you need to go get an iced coffee. I'm like, yeah, you know what? I haven't stepped away from this desk. And so then I need to be doing that for them. Have you taken a breath today? Are you okay? Do you need to unplug for a bit? Like, to your point, Carole, celebrating the flexibility that meets what they need where they are. I think that then gives them the psychological safety to talk more about what they need and where they're at. And then that way you can also be more aware of the programs and things available and weave them in when appropriate. So I think it starts with you and then your immediate team. And if that's all you can solve for, that's still doing more than we've been doing.
Yeah.
It's a start, right?
Yep, absolutely.
Okay, one more question came into the chat or the Q&A. One of the issues we have encountered among workers across many sectors, including healthcare workers, is that even though programs are provided, the workers are not making use of these resources. What are your suggestions on best approach to get buy-in and encourage engagement?
Mm-hmm.
One of the things that we found in past research, Sarah has done a lot of work around this, is awareness. Many employees don't even know programs exist, and communication through different channels, because different employees have different favorite ways to communicate. You know, is it IM? Is it email? Is it snail mail? Whatever it is, just reach them. But again, I think that piece with the team needs to take place. The training for the managers need to create a buzz. Just talk about it. If you hear about another employee using a certain resource, just talk about it.
Yeah, see if they're maybe willing to share their story. I also think, I mean, we're talking about research. Ask your employees, what do they want? Is what we have available, is this enough?
Yes.
Is this actually something that's valid for you? I don't think we've ever done kind of like an audit, of, well, what do employees believe about all of the benefits we have on our menu? And I personally just went through my open enrollment on Sunday, and it was easy and great. And, as I'm looking through, I'm like, wow, I keep forgetting that we have some of these other things. I found out about our mental health, platform solution through that. And then once you get connected, then that solution or entity might start to reach out to you via, text or email. Then you kind of have a direct relationship. But before that, if you're not reading your benefits booklet, are we doing a good enough job of making sure everybody knows what's out there? And are these the things you actually want? Maybe we'll find out that there's something we're not providing that our employees are really begging for, and that would really help them do their job more effectively, and more importantly, help mitigate some of these mental health concerns.
Yes,
Okay.
and a good segue, I'm sorry, good
Go ahead.
segue, Jim, to my next research project, which is
Mhm.
about managing and measuring the effectiveness of these programs. So you can do that audit.
Carole, thank you. This series that you've done has been really eye-opening for me. Someone with a lot of experience in the industry, and thought I had seen a lot of these things firsthand. Your reports have just really been informational and hopefully actionable for our audience of member companies and the industry writ large. So thank you for all the work that you've done in that series. Christin, thank you for being with us today, for sharing your perspective, and for the work that you're leading at Voya, because just as we've talked about today, if we can make one impact on a company, on an employee, on a family, that's well worth our time and effort, and it helps us out as society. So thank you for what you're doing.
Absolutely. Thank you.
For everyone on the call, just in the next few days, certainly by the end of this week, an email will be sent out. We'll have the link to the recording of this webinar, the slides, and the report will be available. So be on the lookout for that. Thank you for joining us today, and we look forward to you on the next webinar with the Integrated Benefits Institute. Good day.
Thank you.